Yes, greetings to you all. Yeah, we welcome you back to our healthy talk show. My name is Caleb Chimeze, a volunteer from Nakasongola Health Center 4. And together with me, I have a colleague. Um, Say hi to the dear viewers.
Hello, good morning. Hope we are well. Hope our health is well. My name is Bridget, a clinical officer working with Padro Pure Medical Services in Namasuba, Masaja.
Wow, that is beautiful. You look so smart today.
Thank you,
Wow.
Caleb.
Yes, we are always delighted and honored for each of you who take off some time to watch UBC, especially our healthy program. Today, we are going to be discussing an interesting program each of you wouldn't love to miss. Madam Bridget.
Yes.
Just of recent, I was trying to look at the rates of non-communicable diseases globally, and I had to zero down to a country like Uganda. And I realized that Uganda is one of the countries that is in an epidemiological transition from the prominent infectious diseases
to the non-communicable
yes, to the non-communicable diseases. And when you look at these non-communicable diseases, majorly we have the cardiovascular diseases.
Yeah, those things that don't come from one person to another.
To another, yeah. Definitely. We have cancer, we have diabetes, psychiatric conditions. But what is interesting today, we are going to zero down to diabetes.
Diabetes mellitus.
Yes, diabetes mellitus. Before maybe we go deep into diabetes, a little bit of statistics. The most interesting part about, I don't know if I should say an interesting part, but I was looking at the statistics that was made in 2019, and they were like globally, about 462 million people have diabetes.
That's a big number.
It's a big number. And actually, these people are saying that diabetes is the 7th cause of death globally. But however, they say that the rate at which people are dying could be actually a little bit low, because they say it is 4.2 million.
So meaning the disease or the condition is controlled?
Is controlled.
So it can easily, the risk of dying when someone has it is low.
Is kind of reduced. Okay. Yes. Madam Bridget, Musao Bridget, what is diabetes mellitus?
Now, diabetes mellitus, or what we call high blood sugar levels, first of all, it's a chronic condition.
Yes.
Chronic meaning it doesn't cure. Like, it takes a longer period when you have it. Like, you can be with it for like 5 years, for 7 years. Then it takes a long period when you have diabetes mellitus.
Sure.
So it's a chronic condition.
Okay.
Where there is high blood glucose levels for a longer period of time.
Yes.
With someone.
Okay.
Basically, we all have glucose in our blood.
Yes.
But then when it goes beyond a particular value, there are values that we depend on to say that now someone is getting diabetic.
Yes.
Or they are getting diabetes mellitus.
Okay.
So diabetes is that chronic condition in which someone's blood glucose levels are higher for a long period of time, for some long period of time. Okay. They keep on being higher, more than a certain value that we always consider.
Okay.
Yeah.
Maybe to add on to that, actually, like you said, it is a chronic condition that is sometimes caused due to insufficient production of insulin.
Insulin by the pancreas.
Yes, by the pancreas. Or it can be when the insulin is produced in the body, it is not effectively used by the body.
The cells don't absorb it properly.
Yes. Bridget, we've heard about people talk about diabetes. What do you think are the types of diabetes mellitus?
Basically, diabetes mellitus has around 3 types or forms.
Okay. There
is diabetes type 1 or type 1 diabetes.
Okay.
That one is common in the young children. Like it's common in the young children. Why? Because someone is born with a pancreas that is not able to produce enough or sufficient insulin in the body.
Okay.
So someone grows up having, or like within 2 years of age, 5 years, 7 years, someone starts getting symptoms that indicate that someone is diabetic.
Okay.
Why? And the main reason as to why this happens, or the main cause of diabetes type 1, is because the pancreas is supposed to produce insulin that breaks down the sugar levels, but it's actually not producing enough of it.
Okay.
That is diabetes type 1.
Okay.
And it's common in the young children.
Okay.
Like someone, you see a young child 7 years and they're really having symptoms of diabetes, which we are going to talk about.
Okay.
Then there is also diabetes type 2. That one mainly comes in adult age. Okay? The more someone grows up, that's when they get it. In this case, the pancreas produces enough insulin, but then the cells, the body cells that are supposed to absorb that insulin, they're not functioning properly or the way they should be functioning.
Okay.
For factors we shall also look at.
Yeah, definitely.
And this type of insulin, diabetes type 2, is common in the elderly, people who are fat or obese. Okay, someone may not be obese, but when they are fat, like they have a lot of fat in their body,
Okay.
or people who drink a lot of booze,
Okay.
or who smoke.
Okay.
So like those are risk factors.
Okay.
Those are the kind of people that can get diabetes type 2.
Okay.
So we also have another form of diabetes, which we call gestation diabetes.
Gestational diabetes.
That one mainly comes when someone, in ladies or women who get pregnant,
Okay.
and then you find yourself getting diabetes out of the blue. You didn't have it, you've been normal, but then something happens, the cells, the body, the pancreas, the insulin is less, and then you get what we call gestational diabetes. But that one, most of them, 70% of the ladies, it cures after they give birth.
Okay.
Yeah, it goes after they give birth and they go back to normal.
Okay.
So those are like basically the 3 forms of diabetes that we have.
You've actually answered my next question. I was about to ask, can you tell us the types of diabetes mellitus basing on pathology? So you've actually described the types basing on what causes them.
Yeah.
To add a simple point on that, out of the 462 million people I told you about that are suffering from diabetes globally, according to statistics, they say it is 90% of the 462 million people are suffering from diabetes mellitus type 2. So should we believe that when you look at these diseases like diabetes, like cancer, generally the non-communicable diseases, some people refer them to lifestyle conditions.
Yes.
Should we believe that when people are born, the way they live their lives predisposes them to getting diabetes?
That is very true, because the major causes of diabetes or the risk factors are basically the lifestyle that we live in. Lifestyle can take in the physical exercise that someone does. Most of the people who are inactive when it comes to physical exercise, they are at a risk of getting diabetes. The diet is also a lifestyle.
Yes.
The things we eat, eating a lot of sugary things, eating a lot of fatty foods, can predispose someone to getting diabetes.
I'm eating fatty foods because I need to be fat. Could that be a factor that would predispose me to getting diabetes mellitus?
You know, not only fats can gain you weight. You can have proteins, you can have carbohydrates, and you still get that weight. You get it?
Yes.
Yeah, and a lot of weight is also not good. Also being small is not good, but too much weight comes with a lot of risks of getting these non-communicable diseases.
We are living in the world where they say that being fat is a symbol of being rich. So are you trying to stop people from being fat or something of that kind?
Me, I'm so sure that thing used to happen a long time ago. Nowadays, we look at being fat as a disease.
As a disease?
Yeah, because it comes with a lot of risks of getting so many diseases like hypertension, like diabetes mellitus, what we are talking about, all cardiac infections, diseases can come with heavy weight. So basically, being fat, I wouldn't call it a sign of wealth. It's actually a sign of being unhealthy. Yeah.
So that communicates to me that if you're obese or if you're fat, as in quotes, because someone can be fat in a healthy way.
Yeah.
But when you're obese, that means that there is a lot of predisposition of fats in your blood vessels.
That is true.
And at that point, that means that when the fats are lodging on the walls of the blood vessels, there is going to be a small outlet.
That is true.
And that means that the rate at which the blood will be moving through your blood vessels is going to be high.
Yeah.
And at the end of the day, your health worker is going to diagnose you with hypertension.
Heart conditions.
Yes, heart conditions. Madam Bridget, at that point, would you please elaborate more about the risk factors? What are the risk factors that can predispose someone to getting diabetes mellitus?
Okay, now, as we said, we have different forms of diabetes.
Yes.
Diabetes type 1, basically the cause is not clear.
It's not clear.
It's not clear because someone is born and out of the blue, their pancreas ain't functioning properly.
Okay.
It's not producing enough insulin as it should be producing. Like, it just happens. That is diabetes type 1.
Okay.
But diabetes type 2 has a lot of risk factors, especially the lifestyle.
The lifestyle. Okay.
The lifestyle that can be inherited, that's one thing. If it's within the family and you have someone in your family with that history of diabetes, so that means you're at a risk of also getting it.
Could it be the case as to why when patients come to a health facility, health workers tend to ask them about, in your family, is there anyone who has ever suffered from diabetes?
Yes, we always ask that and we see if you are at any risk of getting it.
Okay.
That is the family social history is always taken when you go to the hospital for that. So it can be inherited.
Okay.
So if you have someone in your family, they have a history of diabetes, that means you are at a risk of getting it.
Diabetes mellitus.
Yeah. Then another risk factor or something that can predispose someone to getting diabetes is inactivity, physical inactivity. People who are always seated, they don't work out, do some exercise, do some workouts. Like, your body is really becoming dormant. You're not burning enough fats.
Enough fats.
Yet the fats are there, you eat food, the fats are in the body, they need to be burnt.
Okay.
The more they attach on the cells, that means the insulin is going to be produced by the pancreas.
Okay.
But again, that it's not going to be able to be absorbed in the cells because of the fat deposition on the cells.
Wow.
So you have to always work out, do some exercise. People who are inactive, physically inactive, you are also at a risk of getting diabetes mellitus.
That reminds me of an English proverb that says that an idle mind is a devil's workshop.
Devil's workshop, yeah.
But however, exercise really helps us to put our body in shape. When our body is in shape, we tend to push diseases like diabetes away. The other thing is I tend to tell people while doing exercise, learn or ensure to do exercise that is beyond the one your body is used to. Some people will tell you that for me, when I'm going to work, I foot. Right? But then your body is used to that distance. So if your body is used to that distance, that means it is not creating great impact to you. You're not challenging yourself. Yeah.
So basically that means if today you are going to run 2 meters, tomorrow make it 3 meters.
Make it 3 meters.
Then the other day make it 5 meters.
Okay.
Like, as you do it, not too much, but you make the body get used to something bigger than that. Yeah.
All right. Madam Bridget, there are quite a number of things that can predispose us from getting diabetes mellitus. What others?
So we've talked about
physical activity. We've talked about genetics. It can be genetical. You said it can be environmental.
It can also be environmental.
Yeah.
It can also be through the diet that
we eat.
The food we eat.
Okay.
People who smoke, you're at a risk of getting diabetes.
Okay.
If we eat a lot of fatty foods, we are also at a risk of getting diabetes. If you eat a lot of sugary foods, yeah, those added sugars like the sodas, the drinks that are manufactured, you are also at a risk of getting what? Diabetes mellitus.
Madam Bridget, at that point, we've talked about how we can differentiate diabetes mellitus type 1 from diabetes mellitus type 2. And we've actually looked at the risk factors. I want you to tell our dear viewers, what are the things that I look at, the things I start experiencing and start worrying, or maybe I could be having diabetes. What are the things maybe a health worker or that person who is at home would look at, or the
And-
clinical features of
and
diabetes
make them
mellitus?
suspect that I have.
Yes.
Okay, first thing we should know, we have diabetes type 1 and diabetes type 2.
Yes.
It's always about the insulin. It's either less is produced or it's produced and it's not being used.
Okay.
So basically, most people with diabetes type 1, they are small, they are thin.
Okay.
Unlike in diabetes type 2, where it's common in people who are fat. Diabetes type 1, they are young and they are thin, they don't gain enough weight. Diabetes type 1, this is when someone drinks a lot, they over get thirsty. Like every time you feel like drinking, you quench for something. It's a sign. It could be a sign that maybe you're getting diabetes or your child is having diabetes.
Okay.
When someone urinates very often, there is a lot of urine output. It's also another sign that maybe your child is getting diabetes type 1.
Okay.
This is when it's in children.
Okay.
Then we also have someone getting hungry very easily.
Okay.
Because what happens is that there is the pancreas is not producing enough insulin. So the insulin breaks down our glucose
Okay.
into other forms like glucagon, is it? Then glycogen. Then those forms are then absorbed into the body. Then the body uses that glucose in that form.
Okay.
So if the insulin is not enough, meaning the glucose is not going to be broken down.
Okay, that is
properly.
beautiful. Actually, talking about, maybe to add something little, you've said the points. Maybe there's someone who would like to summarize them. There's three critical or points that we look at, especially when diagnosing diabetes mellitus. We look at polyphagia. She explained it.
That is when someone feels like eating very often.
Yes, eating very often. Then we have polydysphagia.
That's when they get thirsty.
Getting thirsty and quenching, like taking in frequent
Every time you
amounts of
feel like
water.
drinking.
Yeah. Someone can even take a 10-liter jerry can in
possible.
24 hours. Then we have polyuria.
That's passing urine frequently,
yes.
and a lot of it, like the urine output is increased.
Then the one that supplements the three is someone gets tired quickly. Yeah, someone does a small thing and is tired. Someone has not done anything. You just feel like you're weak, you're tired. Wow.
It is also common, even in some cases, when it's too much, someone's blood gets the vision, gets interrupted. Like the way you see, maybe can get a dull vision, you don't see things clearly. Or if you're seeing objects, they're in a different shape. When now the glucose is now entering the nerves of the blood vessels of the eyes, they're getting affected, so the lenses also get affected. Then the bowel vision comes in.
We have many patients. We have many patients in the villages there. Some of them, they have diabetes, but they have not taken time to find out or to check out with their health worker or their doctor. And this diabetes keep on, I would borrow the word growing, or it keeps on progressing every now and then. What are the complications that a patient may get if is having diabetes but not attended to? Yes. Or this patient is already diagnosed with diabetes mellitus, but is not taking the meds, is not taking the drugs appropriately. So what do you think are the acute or maybe the short-term complications and the long-term complications of diabetes mellitus?
So those are things that might arise when someone has diabetes and it's not treated, or it's not controlled, right? So there are so many complications, because basically our bodies should have some limited amount of glucose in it. So if that means if your glucose goes beyond that values or that amount that the body needs, it's going to become a problem to us. So the complications that can come in acutely, someone can go into a coma.
Definitely.
Someone can go into a coma because like mental confusion comes in, because of the glucose levels are really high.
Okay.
That is one thing. That's the one thing we call non-ketonic hyperosmolar coma.
Honk. Or
Yeah,
some people abbreviate
we
it
call
as
it
honk.
HOC.
Yeah.
Then they can also get
Diabetic.
acidic ketoacidosis.
Yes. DKA.
DKA.
Yes.
That one is common in diabetes. Maybe someone has had it for a long time and they
Okay.
didn't know, or maybe that's how most of the people are diagnosed when they go into DKA,
Okay.
where there is confusion. Sometimes can come in, though
Okay.
it's common on the other side.
Okay.
That's how do you know that someone is in DKA? There is high glucose levels.
Okay.
Sometimes they get nausea, then vomiting, then they get abdominal pain, and they are disoriented. They are feeling thirsty very fast. Okay? They want to drink very often.
Okay.
Those are signs of DKA.
Okay.
So someone can have all of those things: nausea and vomiting, abdominal pain, tenderness on the abdomen, palpation, and then when you check, the glucose levels are higher than normal.
Yeah, maybe to add on what DKA, actually we are having the word ketones in between.
Yeah.
There's always increased, or there's an accumulation of ketones in urine.
Yeah, because the fatty acids are now being broken down.
Yes, so a patient will come complaining that my musao, I think one of these days my urine is smelling good.
Yeah,
it is smelling like nice jackfruit or ripe jackfruit. So that can be a sign of a DKA as well.
That is true.
Yes, besides DKA and honk, we have quite a number of other complications. Like we said, we have short-term and long-term. We can have things like a diabetic foot.
Yeah, that is a very common thing.
It's a common thing.
Yeah, diabetic foot or diabetic ulcer.
A diabetic ulcer. Yes, then we can have things like peripheral neuropathies.
Yeah, a diabetic ulcer, before you go, these are the ones that if you get a wound on your feet, any of them, and you have diabetes, you have a wound, you're treating it, it's not healing. Basically, these wounds take long to heal. They are so hard to treat, and they might end up leading to someone having their foot amputated. So that's really a bad complication of high glucose levels in blood.
So that means a person with diabetes mellitus, their chances, the healing process is kind of lower than a person who doesn't have diabetes mellitus.
They should be so cautious when it comes to their skin, their body.
Okay.
Yeah.
Okay. Maybe in addition to that, when you have increased levels of glucose in your blood, we tend to have vital organs losing it. Okay. We tend to have things like kidney failure.
Yes.
We tend to have things like stroke.
That is true.
Yes. We tend to have things like
there is diabetic nephropathy. That is the kidney.
Exactly.
Chronic kidney disease. There is diabetic peripheral nephropathy.
Okay.
That is when the nerves are being affected. Then there is also
that is a time when a patient starts getting those tinkling sensations.
The numbness, they feel something is like those pricking things in your feet or in the extremities of their hands. They are common. That means now the nerves are also getting affected. You're getting a peripheral neuropathy or something like that.
Okay. Madam Bridget, you know time is running out.
Okay.
How do you diagnose diabetes mellitus? What are the investigations you do to say this person must be having diabetes mellitus?
Okay. First thing, as we've talked of the signs.
Okay.
Someone will come with those signs that frequent urination, drinking a lot, thirsty every time, especially in the night. Itching of the body is also one sign of diabetes mellitus. So when someone tells you those signs, there are some categories of investigations we take on.
Okay.
Basically, we have 4 of them. We check for the glucose levels in blood.
Okay.
The first one we do is the fasting blood glucose level, the FPS.
Okay.
That one we do it when someone has taken maybe a period of 6 hours when they last ate something.
Okay.
And we check the glucose levels in blood. If we believe if it is 7.0 or more than 7.0 millimoles per liter, then someone can have diabetes mellitus.
Okay.
And they have all the signs
of
diabetes.
Okay. Then what is the other sign we can do maybe?
Then we also have a random blood glucose.
Okay.
But then that one happens, it can harm when someone has the symptoms, and then you check their blood glucose levels and the values are 11.1 or greater than 11.1.
Wow, it has been so beautiful hearing from you, Bridget, articulating down diabetes mellitus. Our dear viewers, thank you so much for tuning in. We look forward to reaching to you next week. Bye.
Thank you.